Vitamin B12 is one of the most important nutrients, which plays vital role in various health conditions. Vitamin B12 deficiency is a globally prevalent phenomena. According to references, vitamin B12 deficiency in different parts of the world is about 70% of adults in India, 62% of vegetarian pregnant females in Ethiopia, 20% of population in the United Kingdom, 40% of children and adults in Latin America, and about 20% of population in the United States. Recommendations suggest that plasma levels of less than 200 picogram per milliliter is referred as B12 deficiency. B12 level between 200 to 350 picogram per milliliter is called borderline level. B12 level between 350 to 500 picogram per milliliter is considered adequate level, and more than 500 picogram per milliliter level is considered as normal B12 level. Multiple causes can lead to B12 deficiency, like vegetarianism, commonly used drugs like metformin, proton pump inhibitors, etc., surgery, malabsorption, chronic alcoholism, gynecological conditions, autoimmune disorders, and genetic factors. Current options of vitamin B12 supplementation have major limitations. Currently, for treating vitamin B12 deficiency, 3 types of formulations are available: oral tablets, sublingual tablets, and injections. Limitations of oral tablets: poor and unpredictable absorption pattern, non-compliance due to long-term daily dosing, unfavorable cost-to-benefit ratio due to poor absorption. Limitations of sublingual tablets: poor absorption of vitamin B12 through sublingual route because of large molecular size. Rapid clearance by saliva leads to poor retention at sublingual mucosa. Thus, the fate of sublingual tablets remains same as that of the oral tablets. Limitations of injections: painful administration leads to non-compliance. Administration requires visit to clinic, hence time-consuming and inconvenient. Increased cost of treatment. Introducing the world's first intranasal drug delivery of vitamin B12. Manufactured by Troika's globally patented Nazo Max technology. To make it accessible to all patients of India, Troikaa has launched its intranasal methylcobalamin in 3 different marketing divisions. Nazo B12, the patented intranasal drug delivery of vitamin B12, rapidly corrects deficiency without the need of painful vitamin B12 injections. Manufactured by Nazo Max technology and is globally patented by Troikaa. Corrects vitamin B12 deficiency in 7 doses. And maintains vitamin B12 levels with once-weekly dose. Let us now understand how Nazo B12 works. Nazo B12 is to be administered in the nasal cavity. The nasal cavity has 3 different regions: olfactory, turbinate, and vestibular. Fine mist of vitamin B12 goes into the turbinate region of the nasal cavity, through which maximum vitamin B12 is absorbed. Nazo B12 delivers vitamin B12 in a specific pattern that is validated through plume geometry, allowing maximum absorption of drug. Vitamin B12 passes through the pseudostratified columnar epithelial region and enters the blood vessels. Vitamin B12 is then transported with blood to other organs of the body. The single-dose pharmacokinetic study of Nazo B12 confirmed that it provides rapid absorption of vitamin B12 through nasal mucosa in just 12 minutes. Vitamin B12 levels in the same volunteers were assessed for the next 5 days, which confirmed assured B12 levels above 500 picograms. Thanks to Nazo Max technology, as shown in the table. While Nazo B12 achieves maximum concentration of 19,779 picogram per milliliter in just 12 minutes, methicobal intramuscular injection takes 54 minutes to achieve maximum concentration of 22,400 picogram per milliliter. This proves that Nazo B12 is as good as methylcobalamin injection. Nazo B12 corrects vitamin B12 deficiency in 7 doses and maintains vitamin B12 levels with once-weekly dose for next 4 weeks. One such course of Nazo B12 3 times a year ensures healthy B12 levels round the year. A prospective, multicentric, non-comparative clinical efficacy study of Nazo B12 in vitamin B12 deficient patients was conducted. For treatment of B12 deficiency, 1 spray of Nazo B12 was given in each nostril every alternate day for 2 weeks. Clinical trial confirmed that all patients recovered from deficiency with minimum inter-individual variability. For maintenance of B12 deficiency, 1 spray of Nazo B12 was given in each nostril once a week for next 4 weeks. This confirmed that vitamin B12 levels of all patients were maintained well above 200 picogram per milliliter. Nazo B12 is equipped with a unique nasal spray pump. Each spray delivers precisely 0.05 ml solution, which is equivalent to 250 micrograms of methylcobalamin. Nazo B12 delivers vitamin B12 in a specific pattern that is validated through plume geometry, allowing maximum absorption of drug. Using Nazo B12 is really very simple. Nazo B12 dose is best administered when the nostrils are clean. Priming of Nazo B12 is important for accurate dose delivery. On purchase of a new bottle for the first time, priming has to be done by spraying in air 6 times, keeping the bottle away from the face. After priming is done, close the left nostril and gently insert the nozzle about 1 cm into the right nostril. Then press down firmly and quickly to spray while holding your breath. Now close the right nostril and gently insert the nozzle about 1 cm into the left nostril. Then press down firmly and quickly to spray while holding your breath. That's it. You have completed your first dose of Nazo B12. You can now mark the dose as dose taken in the dosing chart. Please remember to keep the bottle back in the box after every use to protect from light. For routine use, before taking each dose, priming has to be done by spraying 2 times in air. Nazo B12 is not just effective but most affordable too. For treatment of vitamin B12 deficiency, the required doses with Nazo B12 are 7 on alternate days, compared to 10 doses on alternate days with methylcobalamin injections. The cost of therapy with Nazo B12 is Rs 325 only, compared to around 800 rupees with injections. Nazo B12 offers assured efficacy and is absolutely painless. And most importantly, using Nazo B12 is very convenient. Whereas injections are efficacious but extremely painful. Moreover, administration of injection requires visit to clinic, making it very inconvenient for the patients. For maintenance of vitamin B12 deficiency, the total duration of maintenance therapy with Nazo B12 and methylcobalamin tablets is 3 months. But a required dose with Nazo B12 is just once a week, whereas that of oral tablet is 1 tablet every day. The cost of therapy with Nazo B12 is Rs 325 only, compared to around 900 rupees with tablets. Nazo B12 offers assured efficacy with convenience, whereas tablets have unpredictable efficacy and hence longer duration of therapy. For reminding patients about the dosage and other relevant information, an Android and iOS app for each brand, that is Nazo B12, Nazo Cobal and Rhino Cobal, have been developed with their respective brand names. This app can be easily downloaded from Google Play Store and App Store without any charges. Nazo B12, an original research product of Troikaa.